We also have uniform. The uniform is to make it easy to administrate. It's easier to manage with unified clothes.
好，那我们现在看到的呢，就是在进行安检的时候，每个医院过来的大家队服都有一定的辨识度。那么现在正在
Right now, you can see that our medical team is going through the security check. This is our colleagues from from Beijing, from hospitals in Beijing. As you can see, that they will have the luggage.
好，那我们刚才协调了一下。
Most of in these containers are the most needed medical materials. And this squad, this team, is from PUMC.
我们现场因为可能人员也比较多啊，我们可能需要去协调一下后续，能不能到停机坪？现在离出发时间也已经比较紧张，我们前面哇，100多个人的医疗队出征，这个场面还是非常。
We don't know if we can go past the security check. We have right now more than 100 medical professionals in this team.
多米长，我们看到也是比较长的。现在其实现场气氛大家看到是相对来说还是比较轻松、比较欢快的。
Right now, a line of about 20 meters has been formed, but you can see the atmosphere is still quite agile. It's quite light. Because this team is fully prepared and their professional skills are very trustworthy.
那我们现在呢，也是在等待机场相关协调人员，然后等候我们能够到停机坪的附近，和大家看一下能不能目送我们的医疗队前往前线。
Right now, we're waiting for our pass to the beyond the security check. We need to wait and see if we can go past the security check all the way to the parking apron to send our medical staff off.
哎，你帮我把这固定住，固定不住。
好，那我们现在刚才协调了一下工作人员，
到这边了。
好，我们现在又进到了安检大厅当中。对。
Right now we
另外一个
are
不在。
entering the security checkpoint.
我们现在在直播中，我们现在在直播中啊。好。
身份证登记牌、充电宝火种提前取出来，感谢各位领导。
好，那么我们现在也是得到了特别的许可，现在由工作人员带着我们前往停机坪上来目送和战士们在一起。需要安检吗？
Now we have
好的，那我们
gained our
好，那我们接下来
access
可能
and
这边
we
是安检
will
的地
be
方，也不能
able
拍照。
to
我们要
go
把
to the
设备放
parking
到
apron
X 激光
to
机中，
see them
现在
off.
稍微会信号断一下。
We need to pause this live broadcast because now I have to go through the security check.
正常过就行了，不用。
养兵千日，用兵一时。危难之时显身手，是革命军人、革命军医的本色。我们经历一个 SARS 以及非洲抗击埃博拉。
We have experienced SARS and Ebola, and we're fully confident that we can tackle this challenge. I've been to Wenchuan and SARS, and right now our country needs us again. We will answer to the call of the nations and fight and win this war. To be honest, I am a bit worried, but I never regret any choices that I made. My wife supported my work. She is actually 4 months pregnant. We don't know what is lying ahead of us, but I know that this is a daunting task. I will summon my courage and fulfill my task. the Central Party Committee have
好，
established
那我们
a
现在回
leading
到
group
了直播的现场。
of
感谢大家刚刚的等待， 因为
fighting
我们也要遵循
coronavirus
机场的
epidemic.
所有的这个安检规则，然后把所有的设备放到 X 光机
Okay,
当中。
right
那
now
么现
we
在
are
我们
back
是在百度
to
大巴
our
上，
live
那么我们
streaming
可以看到
because we just
从
now
这个
needed
接
to
楼
go
出来之
through
后
the
所
security
有
check.
的医务人员呢都要乘坐上大巴，然后
Now we are
向
on the
飞机
shuttle
的
bus.
登机的地方。那么我们现在看到，其实人员已经上了大概有30-40人的样子，而在不远处。
After we exit the terminal, all the medical staff will be boarding the shuttle.
通过一个车辆的后方改造成的一个 X 光机检测口，那么可以看到医院的，刚才我们包括我们采访过北京大学人民医院的相关医疗资源的这个储备啊，还有运送的负责人告诉我们的，他们。
Is a vehicle that carries the medical materials that will also be transported to the affected area.
那么我们现在其实也可以看到，通过已经运输进来的这边，包括
There are 31 boxes of medical materials.
飞往武汉的这个标签，大家可以看到是武汉 CA0043，那么今天26号飞行，很多
We have Beijing 3rd Hospital, and as you can see, all the luggage are tagged.
这次医疗队前往前方的集结的时候的这个包括要求，包括这个集结的口号发出来的时候，大家踊跃的报名，那么人数很快的就爆满。而与此同时呢，其实大家也进行了很多医疗资源方面的一些储备，包括这里可以看到是10盒检查手套，上面写10盒，这个也是已经进入到行李车当中的北医3院的行李盒。那我们这里大体数了一下，可能1、2、3、4，大概已经成箱的医疗用品已经有10几箱以上，那还在陆续的装箱和运送当中。那么这边可以看到是一次性。
Close contact, and all of them are under medical watch. In the 25th, the Jilin province, based on this situation, have decided to kickstart the first level emergency response. The provincial government and party commission attached great importance to the prevention treatment of this pandemic. The first case was found in January the 20th. The provincial leaders had made it very clear since that you need to make a comprehensive deployment in this province and will act according to the important remarks made by General Secretary Xi Jinping and Premier Li Keqiang, and act according to the conference call of the national government, of the central government, and fend off the risks brought about by spring travel season, and implement the prevention control plans and regulations strictly. We need to report early and discover early, and to give timely treatment as soon as we can. A leading group at the provincial level in Jilin province was organized, and the provincial governor was the head of this chairing committee. There are 3 designated hospitals, and altogether there are 68 hospitals at the provincial level, and a fever clinic were put into use. And you have a pre-test clinic, and all the medical staff are going through trainings accordingly. And health management has been further strengthened. And if there's a fever patient, he or she must be quarantined to check if they have caught this coronavirus pneumonia. All kinds of slogan and educational and campaign were made across the city. From the 23rd, we have closed major travel and scenic spots, including Changbaishan, and have called off major activities. And all the travel agencies have suspended their businesses in public places, in markets, and in public transport. They have increased their times of sterilization and have banned transactions of wild animals, have strictened the regulation of farm market, of agriculture market, and make sure that no patient is left behind because of medical fees. Make sure that all patients can receive timely treatment. They also work with embassies such as UK, Australia, and France to gather the foreign residents in Jilin province, to gather information of these foreigners. Just now, the Jilin provincial government just issued a report of the work ahead. First is to conduct coordinated prevention and control of the epidemic. Jilin, the other two northeastern provinces have jointly declared this plan. And besides screening the Wuhan returnees after the spring travel, and the second test would be after the spring travel, the students and migrant workers will be returning from all over the country to Jilin. This is another daunting task to the local administration. We need to pull our synergy together to strengthen our execution and implementation of these plans. I believe that with the strong leadership of the Central Party Committee and the provincial government and our experiences of fighting the H1N1 and SARS diseases, as long as we address this problem and tackle this challenge in a scientific and coordinated way, we are fully capable to deal with and tackle this epidemic. We also need to do more strict screening, especially to the Wuhan returnees and Hubei returnees. If we can manage these most vulnerable group well, will put us in a better position in winning this war. We will also organize medical staff and hospitals to organize their own fever clinic. This pre-test clinic will make it easier for local people to seek medical help when they are experiencing a discomfort, especially fever.
好，我们现场呢找一个相关的医政医管处的领导呢来给我们介绍一下情况。
We will now find a medical authority official to tell us more about the situation.
好，我们看现场呢是正在一个准备过程中，再有20分钟，吉林省援助湖北省抗击新型冠状病毒感染肺炎的这个医疗。
In about 20 minutes, the medical team from Jilin
那么在一个简短的仪式之后呢
will
，135名
will depart
135名的这个医
and
疗
leave
医护人员呢，将会分别乘坐
leave for Wuhan in assistance of the medical staff there.
大概在晚上
And the first group of about 115 medical professionals
奔赴这个
will take these shuttle buses to the airport, and in about 17 o'clock sharp, they will be taking the plane to fly to Wuhan.
那么今天，我们现场呢也请到了这个我们您的职务是张
我是
院处长。
吉林省卫生健康委员会医政医管处。
医政医管。
Well, we are very honored
这次呢情况给我们介绍一下，我们这次是第一批是吧？去多少名医疗人员？
to have Director Zhang from the Healthcare Management Bureau of Jilin Province. So can you tell us more about the situation of our medical staff? In order to support Hubei Province effort in fighting the epidemic, we have altogether sent 135 medical professionals to help in assistance of Hubei Province, and 2 of our officials will come along with them as team leaders. So where are they from? Well, they are mostly respiratory experts, infection experts, and from a severe condition department. Most of them are medical experts with senior titles. And the youngest is 25 years old, and the oldest is 59 years old. And in average, they are 35 years old. Very young, very young team, and highly experienced at the same time. So they all sign up for it voluntarily. Yes, we managed to summon a team of 135 people in about one day. So people are participating in it very willing and with great enthusiasm. So this is only the first group, and we will have 2 backup teams waiting to be called upon. What kind of preparation did we do before the departure? There are many detailed work that we have done before the first group depart. In the second hospital of Jilin Province, all the medical staff have received trainings in terms of infectious diseases. After arrive at Hubei Province, they need first protect their own safety and to conduct more targeted treatment. So when is the flight due? Well, it is supposed to the whole activity, launching activity, will be at about 3 p.m. and we will take the chartered airline and fly from Changchun Airport at 17 o'clock. So all the medical staff in Jilin province are right now on call because we have just kickstart the level 1 emergency response at the provincial scale. All the medical staff have given up their holidays and right now they are in their positions and stay on call. Time is quite limited. This departure and send-off ceremony will take place soon. As we have learned from the instruction of Director Zhang, all the medical staff of Jilin hospitals have given up their holidays and all of them have gone back to their working positions. We saw that the medical staff from Jilin Second Hospital are gathered here. The Jilin provincial government has just issued the plan to fight this epidemic. The first is coordinated prevention and control. The 3 provinces in the northeastern of China have kickstarted their level 1 emergency response at the same time. So this work of these 3 provinces will push ahead in a coordinated way. Besides screening the Wuhan and Hubei returnees, second task will be the returning of the immigrant workers as well as students. In order to tackle these challenges, we have to work together and pull our synergy together, strengthen the execution and implementation of this plan. We believe that with the strong leadership of the Party Central Committee and Jilin provincial government, with experiences of fighting the H1N1 as well as SARS, as long as we can implement these plans in a targeted, specific way, we are more than capable, fully capable, to keep the epidemic under control. We need to know our priorities and conduct strict screening, especially for the Wuhan and Hubei returnees. If we can manage these group of vulnerable people well, we will be putting ourselves in a better position to win this battle.
抗击新型冠状病毒感染肺炎的这个医疗支援队伍呢，他们是刚才还是在这个现场接受培训。
This team was only summoned up yesterday.
马上就会陆续走下来，奔赴湖北的现场第一线。
Most of them have just received their training upstairs, and now they have come down and ready to depart.
因为这次任务非常的紧急和仓促，所以说从画面上看呢，也是这个比较紧急的一个场面。比方说我们
This is
刚才就在刚
quite a hasty task.
奔赴前线的
So as you can see,
刚刚接受完紧急培训，刚刚从楼上。
and we have just learned that
那么他们马上就在这儿要举行一个简短的出
our
征仪式
team of medical staff have just received a
奔赴
training,
湖北武汉的这个第一线。
and they will be boarding the buses to go to the airport very soon and fly off to Wuhan and work at the front line of fighting the pneumonia.
大家就按排站，不要分组了，按排站。从前往后对着前面的人儿看齐，不要站岔排了就行，看齐啊，一排9个人儿。
那么刚刚吉林省人民政府发布的这个通告里边还提到，要做到集中资源，全力救治。疫情防控的目的呢，是要做到4早。
According to the report issued by Jilin government,
早隔离，早治疗。
we will also pool the resources together to conduct training. And there are 4 earlies: early detection, early report, early isolation, and early treatment. And 4 collective. First is to collect the patients, collect the resources, the experts, and collective treatment. So we will reduce death cases to the smallest amount possible, preferably 0 death. And the medical team will be playing a leading role in this effort of fighting the epidemic. And this daunting task is a great challenge ahead of us. We will also be working with relevant department to do screening. And for the already diagnosed cases, we will try our best to conduct treatment to help them recover and reduce death cases to the best we can. During the press conference, the Jilin provincial government have done a report so far to the until yesterday. There are 4 confirmed cases. All of them are travelers from Wuhan, and there are 69 people of close contact that are under medical watch. In the 25th, the provincial government have kickstarted the level 1 emergency response at the provincial level, and the Healthcare Commission have summoned all the medical staff to come back from their holidays and resume their positions. Right now we are seeing the send-off ceremony of the medical staff in assistance of Wuhan in fighting the epidemic. Today with us are our provincial governor, Jin Zhenghai, Professor Zhang Xi from Jilin University, Secretary General Wang, Professor Zhao Guoqing from Jilin University. And with us are also leaders from different departments and organizations, and Jilin First Hospital, Second Hospital, and the affiliated hospital of Yanbian University, Jilin Medical University, Changchun Central Hospital, Jilin Central Hospital, and Jilin Renmin Hospital, and other leaders and colleagues, as well as friends from the press. First, let's give the floor to our representative of the medical team, Mr. Yang Zhuming, to give a speech. Dr. Yang Zhuming. Distinguished leaders, dear colleagues, good afternoon. Since the outbreak of the nCoV pneumonia in Wuhan, people all over the country have given great concern. The total diagnosed cases have amounted to 2005 and 56 deaths. The rising number on a daily basis have touched our heart. This is a severe damage to the country as well as the people, and it is our task and responsibility to tackle this challenge head on. It is our privilege to be part of this task. The Jilin medical workers have experienced many critical battles and made major contributions. Today, among us are colleagues who fight along with me during the SARS epidemic, and there are many senior experts and young colleagues join our team. Hereby, I'd like to extend and make commitment on behalf of my colleagues. In this fight of fighting the nCoV pneumonia, as a medical staff, we feel the heavy burden on our shoulders and a daunting task ahead of us. We will listen to the instructions and listen to the deployment of the local government and do our best and try to give all our endeavors to fight this epidemic in order to win this battle. We will learn from our predecessor, like Dr. Bethune, and we hope that our leaders, our colleagues, and our families can rest assured, because we will be returned safely because you are waiting for us at home. Thank you.
下面，请省委副书记、省长尹俊海同志讲话，大家欢迎。
Now let's give the floor to Vice Governor of Jilin Province, Jin Zhenghai, to give the remarks. Ladies and gentlemen, this is January the 2nd of our Lunar New Year. Instead of enjoying a holiday, you all gather here to depart for Wuhan to join the fight against the pneumonia epidemic. We will be saying goodbyes to our families. This is a daunting task ahead of us, but you're here to represent the 27 million people in Jilin province and bring with you the concerns and support of the province as a whole. Hereby, on behalf of the Jilin government and people, we send you off with affection. Yesterday, I'm sure, all watching TV. On the first day of the Lunar New Year, the Standing Committee of the Political Bureau have convened a meeting to study the work and plan of fighting the nCoV epidemic. General Secretary Xi Jinping had made comprehensive instructions and plan. After this, we have done careful preparation, and 12 relevant departments and the medical institutions and medical staff have signed up very enthusiastically. And just now we've heard one of the representatives of you, who is a senior medical professional with great experience, and she said that in this team we have members both young and and with older age. So my first remark is that faced with such a major epidemic, this is not something that we are willing to see, and it has raised national awareness. The Party Central Committee had asked us for assistance, so that's why we organized this highly capable medical team, and you were there to represent Jilin province. So you need to live up to the commitment and practice the Bethlehem spirit and work at the front line. Do your job well. And second, you need to make more contributions. The Jilin province medical industry, medical cost is quite high and advanced, and to which you all contribute. So after you arrive at Hubei province, make sure that you show that and to use your expertise to fight this epidemic. Third, please do protect yourselves. You are the most vibrant workforce. To protect yourself is the prerequisite to treat the patients well. So please be safe. Dear viewers, right now we are seeing that the medical team that will go to Wuhan in assistance of the nCoV pneumonia epidemic. And this is the sending off ceremony. This whole ceremony will last about 20 minutes, and after this ceremony, the first group of 135 medical professionals will be taking a shuttle bus to the airport, after which they will take the chartered airline to fly to Wuhan to participate in this fight against the epidemic. This morning, the Jilin provincial government have held a press conference. The total confirmed cases in Jilin province is 4. All of them are traveling back from Wuhan, 1 in Changchun, 2 in Jilin city, and 1 in Songyuan city. Number of people with close contact is 69. All of them are under medical watch. First level provincial response was kick-start yesterday. Director Zhang Yan also give us more information. The first group of 135 medical professionals will be going to Wuhan, and all of them are with senior titles. And we have a lot of professionals with great expertise and capabilities. And they're all here voluntarily. They sign up for this task voluntarily. We can see that the send-off ceremony have just concluded. This group of 135 people will be boarding the shuttle bus to the airport and then take the flight to go to Wuhan. This is only the first group, and there are 2 more backup teams waiting to be summoned. They will also go to Wuhan frontline when the time needed.
通过刚才我们了解到，这135名第一批援助湖北省抗击新型冠状病毒的这个医疗队呢，它的平均年龄只有36岁，而且呢都是副高级职称以上的这么一个。
The first group of medical workers has an average age of 35 years old. Most of them are with the senior titles. We have experts, attending doctors. Most of them are from the respiratory department and from emergency department and infection department.
因为现场呢，确实是这次突发性质是特别具有突发性质，所以说我们现场赶紧的看一下，上哪趟车，我们要找一下。
各单位照相，咱一会儿再照。先赶紧上车，快点！请各位参加援建医疗队的老师抓紧登上大巴车。
我们现场让这个相关工作人员给我们安排一辆车，然后我们现场在车上将会采访，是吧？你跟那个副班长。
赶紧先上车，各位队员，赶紧先上车。
没关系，我们站着就行，我们不用坐。
We will also be boarding the shuttle bus, from which we'll be continuing our live broadcast.
不是上这车是吧？好，我们已经登上了这个第一批奔赴湖北的新型冠状病毒这个抗击的这个医疗队伍、医疗支援队伍。
We have now boarded the shuttle bus to go to the airport. We have joined this medical team.
医疗医护人员呢，平均年龄只有36岁，都是副高级以上的职称，然后都是。
These 135 medical staff has an average age of 35 years old. They are with senior titles.
好嘞。
好的，车辆已经出发。那么在今天下午1点30分左右，吉林省人民政府一个新闻发布， 在这里再跟大家通报一下，截止25日。
At about 1:30 this afternoon,
累计
a presser was held by the Jilin provincial government, and I want to repeat some of the information that we learned from the press conference. There are altogether 4 confirmed cases. All of them are transmitted cases, 1 in Changchun City, 1 in the city of Jilin, and 1 in Songyuan. People of close contact amounts to 69 are under medical watch. In 25th, based on the reality and situation, the Jilin province have kickstarted the level 1 emergency response for epidemic. Yesterday, the Health Commission of Jilin have sent an emergency call from January the 26th. All the medical workers need to return from their holidays to their working positions. And right now that order has been executed. All the medical staff have returned to their working positions.
目前呢，吉林省第一批135名医疗队员奔赴湖北武汉支援的这个队伍呢，已经登上大巴车。那么预计呢，他们是在
First group of 135 medical professionals are departing for Wuhan, and we are now on the shuttle bus. And their plane will take off at 5 p.m.
那么省里也是要求呢
and fly to Wuhan frontline to start working. The government has provided them with all the support that they needed and have asked that they all need to stay safe themselves.
那么在吉林省发生第一起确诊之后的病例之后呢，吉林省第一时间成立疫情防控小组，这个小组呢由48个部门。
After the first confirmed cases was found, Jilin province have established this provincial leading group with offices dealing with logistics, treatment, prevention, control, and altogether 8 offices were convened, were organized under this group.
人员可能要互相匀一下，可能我们这个车辆有点少。 截止25日24时呢，吉林省累计报告新型冠状病毒感染的肺炎确诊病例是4例，均为这个输入病例。
To 12 p.m.
那么
20 and 25th,
25到26号
there are 4 confirmed cases
目前得到的消息呢是
or transmitted
这24小时
cases
还没有确定新增的
from the 25th to 26th.
这24小时没有，所以说还是这个目
There
前来讲
aren't
是截至
new
25
cases yet
累计的
discovered yet.
这4例呢还是都是输入病例，其中呢长春市1例，吉林市2例，
So
松原市
far,
1例。目前累计追踪到密切接触者
still
64
4 confirmed cases, all transmitted in.
观察。那么先来看
1
一下这
in
个车辆
Changchun, 2
有
in
点
Jilin
迟钝
City, and 1 in
这是因为呢
Songyuan,
我们的
with
这个
69
医
people
护
with
人员
close
他
contact
们之前
are
在
under
刚刚
medical
之
watch.
前是紧急接受的这个紧急培训工作。那么这个培训工作呢，可能是分期分批进行的。那么我们刚才当时的现场呢，
As I said, all the medical staff have just
而
received
是呢
a training.
他们的医疗人员要进行分期分批的培训，然后各个大巴呢要互相的匀一些这个医疗人员。我们的大巴的数量的座位呢，要多于这个。先可以那什么。这样啊。好，现在先把这个大车那个车在在进行人员安排的时候，给它在。各位央视的网友赶紧关注分享。那么我们这个车辆稍微有点停顿，因为呢，我们第一批135名奔赴武汉前线的这个医疗支援队伍呢，它是因为接到任务非常紧急。
Thank you for watching our live stream.
在刚刚
Right now, the vehicles have halted.
刚才我们看到的现场呢，它的人员呢是刚刚接
As far as we know,
这几辆大巴还要
this is quite a hasty task. All of the medical staff have just received medical training before departure.
机场进行出发。那么在就在刚刚今天下午
So all of the staff need to be rearranged according to departments, and then after that we will continue our journey to the airport.
介绍了一下吉林省的这个疫情的状况，很多人也是关心，可能不单是吉林省的这个网友关心，可能是全国乃至东三省，尤其是东三省附近省的。
So according to the press conference this afternoon,
这个吉林省人民政府最新发布的这个工作新闻发布稿，然后
you might be interested to find out about some of the hard facts
吉林省的疫情状况，
and
也就是截
statistics.
止25日、24时，也就是26日的零时了。25日、24时，吉林省
So according to this report, it starts by telling us about the statistics.
4例，然后这4例呢是均为
By
输入型的病
the
例，
end
一共
of
是4例，这4例都来自于哪儿呢？
25th,
其中长春市是1例，那么吉林
there are
市
4 confirmed
是2例，
cases.
松原市是
All are
1例，
transmitted.
就是这么4例，长春市1例，吉林市2例，松原市1例。
one in
目
Chongqing,
前呢，累计追踪到
2 in
密切
Jilin,
接触者是69人，
and 1 in
就是根据
Songyuan.
这4例的确诊的感染者，然后跟他去这个寻找他的这个密切接触者呢，目前已
69
经找到
people
了
of
密切
close
接触者
contact
69人，这69人呢，目前正在接受医学观察。
are under medical
这
watch.
69人密切接触者已经隔离起来了。那么25日呢，吉林省根据疫情防控的形势，在25日启动了1级应急响应。25日启动了
They
1级
have
应急响应。
been under
那么工作
quarantined.
开展呢，
They are now under quarantined.
在21日就已经做好了这个
Level 1 emergency response was kickstart yesterday. The work began from the 21st.
那么疫情发生后呢，吉林省第一时间成立了疫情防控领导小组。这个小组呢，是由48个部门的一把手组成，也就是这48个部门要
Prevention Control Leading Group was formed with the head of department, 48 head of department. So joint efforts will be put in to shorten the time of this epidemic and limit the number of the cases. So hopefully the 69 people of close contact will turn out to be healthy and not infected. We can see that all the staff have now being reorganized. And this 135 medical professionals will be boarding the bus, the shuttle bus, to the airport and then take the flight to Wuhan.
中共中央总书记、国家主席、中央军委主席习近平作出重要指示：肺炎疫情必须引起高度重视，全力做好防控工作。
养兵千日，用兵一时，危难时显身手，是革命军人、革命军医的本色。
我们经历一个 SARS 以及非洲抗击埃博拉，所以我们经验丰富，能够完成任务。
作为一名参加过汶川玉树抗震救灾的医疗队老队员，已经多次从这里出发奔向一线。现在又是祖国需要我们的时候，我们一定能招之则来，来之能战。
作为一个临床医生，哪里有需要我就应该哪里去。当然说不怕也是假的，当然有人怕，但是我从来没后悔过。
我老婆也很支持我工作，因为我老婆怀孕4个月的她，确实是可能是陪不了她做那个产检。
就像我们面临高考的时候，对高考题也是一无所知。这就像我们去赶一场大考，出题的不是我们，但是我们去答题。
党中央成立应对疫情工作领导小组，在中央政治局常务委员会领导下开展工作，把疫情防控工作作为当前最重要的工作目标。
After the outbreak of the pandemic, the frontline workers have been experienced the undersupply of medical materials. So a lot of the manufacturers of masks and protection suits have summoned back their staff to come to the workshop and start their production. As we can see, this is a production site of masks. This is a mask manufacturer with the annual production ability of 400 million masks, accounting for 30% of the total production nationwide. So it's the biggest producer of masks. Emergency meeting was held on the 20th of January. But after receiving these orders, they have restarted their production from January the 21st. Most of the staff on leave have come back for the work. Right now, more than 130 staff members began to work overtime to produce the masks. There are many types of masks. The mask that they're making is N95 medical mask. It's not professional medical mask, but it can effectively prevent droplets, bacteria, and viruses. It has a protection rate of over 95%. So it is the most popular kind of mask among the general public, and it can effectively prevent the diseases that can pass on from human to human by droplets. In this workshop, we have manual workers as well as a production line. So you can hear some of the noises made by the machines over here. This is not the only type of mask that they produce. They also produce disposable masks as well as medical masks. Right now, 130 staff members can produce more than 20,000 masks on a daily basis, which is only enough for one-day use of 5 provincial level hospitals. So this is far from enough. This is on the 3rd floor. That's N95 masks. And a lot of the frontline workers are in dire need for more medical masks. This is the general manager, Lin Yanfeng, of this manufacturer, of this producer. So can you tell us more about the production of your factory? Almost all of our staff have returned, despite a few cases, a few members who live outside the city. And we are still waiting for the production raw materials to be sent to us. I think this will happen after this spring festival, and by that time we'll be able to produce more than 100,000 masks a day, and we can produce more than 800,000 medical masks on a daily basis, which will greatly cover the need, especially the need of the medical workers working at the front line. Right now, a lot of these masks go to markets and online stores nationwide. Right now, the daily production is 20,000, and during the Spring Festival, because of the logistic problems, we are trying our best to transport these masks to the market as soon as we can. So, what are the major purchasers that buys these masks? Most of these masks go to Zhejiang province, as well as Wuhan and adjacent cities. Right now, this professional medical mask is in dire need. So can you show us the workshop that produces this kind of masks? Sure, let's take this way. Well, this is the workshop that produces professional medical masks, which is the most needed, one of the most needed medical materials of professionals, of health workers at the front line. This workshop is strictly sterilized. We need to go through this sterilization process before we enter, because it is crucial to guarantee that this workshop is very strictly sterilized and bacteria free. As you can see, these are strictly packed and tagged, and these are not our usual packages, but this is the fastest way for us to do this. But we can guarantee that the quality is the same. It looks very similar to the N95 masks, but it is blood resistant and sweat resistance, because if you're working at the front line, you need this kind of higher level protection when you're dealing with patients. So for citizens, it is enough far more enough to wear this N95 masks and leave these kind of professional medical masks to the health workers. So these are masks with the highest protection level. Better leave them to our medical workers at the front line. For common people, for citizens, and other workers in this in the other walks of life, you can just choose the N95 masks. That is more than sufficient. This is our logistic passageways. In order to open that door, we need to close this one first, so as to make sure to reduce the infection possibilities, minimize the infection possibilities. We can take a look at this part.
接下来几天里面，我想加大更大的产能，是做我们的医用防护等级的口罩。
These are assembling machines. In the future, in the next few days, we will further increase the production capabilities, production capacities. In this way, we can produce 35,000 medical masks on a daily basis in order to better meet the need at the front line. Okay, as usual, we need to close this door before we open that one.
所有的口罩，我们在生产完之后，然后是否还就是说还要检？
我们的检验是在我们的上面的5楼，因为现在非常紧实，我们的检验项目呢，也就以最快的。
After the masks have been produced, we also need to go through the quality check, the QC department, to check the filtering efficiency to make sure that it's up to standard, and to prevent our users from being affected, as well as the breathing efficiency. These are two most important indicators. So how is the test done? Well, why not take a look? Well, we can do a demonstration once we enter the QC department. So that you can see more directly how are the masks tested. There are different types of masks, and it is important for different group of people to wear their masks that is most suitable to them. and it's not for common people to wear the N95, and the other the medical masks should be left for the health workers. The materials to make these materials are less in quantity, and you actually don't need to wear masks of that high protection level in your daily life. But this type of mask is very much in need in hospitals where the level of protection needs to be higher.
国务院高度重视。中共中央总书记、国家主席、中央军委主席习近平作出重要指示：肺炎疫情必须引起高度重视，全力做好防控工作。
养兵千日，用兵一时，危难之时显身手，是革命军人、革命军医的本色。
我们经历过 SARS 以及非洲抗击埃博拉。所以我们经验丰富，能够完成任务。
作为一名参加过汶川、玉树抗震救灾的医疗队老队员，已经多次从这里出发奔向一线。现在又是祖国需要我们的时候，我们一定能招之则来，来之能战。
作为一个临床医生，哪里有需要我们就应该哪里去。当然说不怕也是假的，当然有人怕，但是我从来没后悔过。
我老婆也很支持我工作。因为我老婆怀孕4个月的话，确实是可能是陪不了她做那个产检了。
就像我们面临高考的时候，对高考题也是一无所知。这就像我们去赶一场大考，出题的不是我们，但是我们去答题。
乘着我们航班的是一群特殊的乘客。
党中央成立应对疫情工作领导小组，在中央政治局常务委员会领导下开展工作，把疫情防控工作作为当前最重要工作来抓。
刚才我们看到，我们是通过到了我们现在的技术研发中心。因为进入电梯的过程当中是没有信号的，所以我们
So through our camera, currently we are actually at a local Hangzhou mask producer, and we are about to. The manufacturers and the producers is actually recalling all of his staffs to rush into the production of the medical masks. So welcome back all the viewers for CGTN. And I think all of the viewers who are watching our show is those who are care about the up-to-date information about the novel coronavirus disease. So let me give you a more updated information about the factories. Let's give us a very brief introduction about how do we make up the masks. Of course, everybody wears the mask every day, but nobody is quite sure about what is the effect of the masks and who is suitable to what kind of the masks. Of course, we have some of the medical guidelines to follow. So through the glasses, we can see one of our laboratories, and this is a special laboratories for the residue examinations for the medical masks, checking how much is the volumes of the bacterial residues. And of course, through this one screen of the machines, we are going to see are there any leakage of the bacteria in the masks. Are there any leakage in the upper side and in both sides of the face? If the leakage is reaching over 8%, that is unqualified medical work masks. So this is one of our laboratory experts checking about the filtration efficiency and also the resistance experiment. So through this CFT equipment, it is going through 85 minutes to be connected with the nitrogen to check about the particles who have a diameters of 0.075. Through 1 minute, I'm going to have the result about whether this batch of the masks is qualified or not. So if we can put this mask on, we are going to be sure that whether this nitrogen can be put into this mask and how high the infiltration ratio is going to be. We can also enter into the experimental room to check about the process. So all of the data is shown on the screen, indicating the peak and the valleys. 85 millimeter per minute, that is the national standard. This is actually the examination result. So of course we also have the 99.4%, 99.5% and 99.7%. Of course, because the national standard is 99%, while as a producer, we have to make our production quality higher than the national standard quality. And for the different types of the masks, it also have a different ratios of the resistance. For the medical type of the medical masks, it has a higher resistance force because the surface of it is not that porous. It gives a lot of the resistance. That is for the different branches of the examination. All the results are listed here, and all of them are above 99%. That is how we guaranteed that all the product can be used to the forefront medical workers. And this is one mask we have made so far. And for these days, we are doing this special type of the masks. And for the infiltration ratios, it's around 0.01%. Let's look at the data. Apart from the data, we cannot check it through the naked eyes because the infiltration ratios about these particles cannot be checked by the naked eyes. If the particles can be checked by the naked eyes, that is not qualified for all of us to make it as a standard, because those particles who can be noticed by the naked eyes can also be filtered out through the nasal hairs. So that is to say, for the PM 2.5, we cannot see it through the naked eyes. That's the reason why when there's a lot of the PM 2.5 in the air, we need to wear the professional and medical masks. Let me give you more introductions about our professional laboratories. So here in this laboratory, it is a special laboratory for the bacteria. When I'm introducing this part of the masks, I need to check about the densities about the fibers. So, can you give us an introduction of what she's doing right now? She is cultivating all kinds of the bacteria, and to put the bacteria into the different surfaces of the masks to check and to figure out whether this fabric can be used as a bacteria-proven material. Of course, this is our highest standard. It is just like the material that we are using, and this is the toppest hygiene experimental environment, and equivalent to the neurosurgical operation room for the hospital. So here we are entered into the biological experiment rooms, but I'm not going to open up the door for all of you, and because this is the sterilization room. So through a good examination laboratories, we are going to find out. We are going to guarantee that all the product is qualified and can be delivered to the hands of the clients and also the consumers. For the productions of the medical masks, and also for the examinations of the medical masks, I have seen that here we have a special exhibition room, and this is also one of our gateways to the customers. And all the product is being displayed at the 7th floor. So here there's a lot of the brochures and introductory information about different tasks of the masks. This is one type of the mask that we are producing. It is under the level of KN90. So one benefit of it is that it has a lower respiratory resistance. Sometimes when we wear the masks, all of us is felt that we are quite blocked. And for the different industries, the resistance, rather is it the resistance number correlated with the protective masks? It is just like the data we have seen on the laboratories. So for the first 2 masks we have seen so far, it is of a higher resistance. The material is higher than the KN95, and the higher the resistance is, the better the protection it provides. We can imagine that in the operation theaters and in the clinics, these professional medical workers, they need higher levels of the masks, but it is going to create more resistance when they inhale and exhale the air. Here I want to pay our respect for those medical workers, doctors and nurses who are fighting at the forefront. So we are demonstrating you here several different tasks of the mask, preventing the PM 2.5 and also the medical ordinary masks. We used to have a very good introductory video here introducing you the effectiveness of the medical masks. But because our on-site workers and the engineers is taking his holiday, so we cannot showing you the video. Let's walk to the downstairs or upstairs. We also have a demonstration area. Upstairs and downstairs, we have a packaging room.
暂时的中断。
To avoid further blockage of these signals, we are going to follow the camera to work through the stairs, to go upstairs and downstairs. This is actually the office for our salesperson. This is one of the medical level production factory. This is the special production room for the KN95, and we are heading towards our packaging factory.
包装车间里边有很多的设备，所以说里边会比较的吵。我们先带大家进去看一看里面的整个情况。
And I'm going to demonstrating you the packaging room.
买到的这个口罩，买到是什么样子？我们能看到就是从这儿，从那边把口罩放进去，然后通过这样的一个机器，然后
So here it is the masks where we can buy. So through this special packaging machine, the mask is going through the final sterilizations and packaging. So are we packaging the common or normal masks? Yes. This is what we call the N90 level masks. So this is the production line. And we are checking about how the production line works. I think after the package we are going to enter into the final sales, because these types of the masks don't need to go to the special sterilization round, and we are going to package them out and put them at the first floor for sales. For this special period of time, all of our machines are overloaded, and we actually one of the machines is broken out and suspended, and we actually invite a special engineer from Guangzhou to arrive in Hangzhou to give it special maintenance work. And at this critical moment, we cannot let any suspension or postpone to delay the supply of the masks. And let's go to the first floor to check about the warehouse. The operation side, at the opposite side, the room is actually going through the same procedures, because everybody wants N95 level masks, but actually the N90 masks is going through a quicker production round. So with nothing to offer, I can offer what I have so far. So I actually do whatever comes out best, because I think the quantity is matters most. So for all the masks we have produced so far, we package them immediately, and we are not selling it to the external factories, we supply it to the forefront. And so this is actually one of the packaging factories. This is one of the trucks from the Fuyang City #1 hospitals. I actually supplied to all of the hospitals around my factories. And I actually, this is going to be generally arranged by the local government. Because of the quality, I can only provide a very limited quantity of the medical wipes throughout the Zhejiang province. There's only one factory like us who can produce a vast number of the medical masks. So for many of the hospitals, they came to me, but there are so many hospitals come to our company. We could only supply several different masks according to different types of the hospitals, and we could only supply some of the one-time medical tests and also the N95 medical masks according to the different features of the hospital, and we are going to arrange them with a certain ratio. As Mr. Lin has introduced to us, for the producers of the medical masks, no matter how hard we work, how many workers we recruit, the final medical masks is going to be sent into the hospital.
对于一家企业，我可能生产口罩的企业，我去尽可能的召回员工，去尽可能的生产。对于可能说以这个行业没有关系，我也尽可能的去贡献我的力量。有钱有力出力去多为这个整个的这样一个战斗做着贡献。那对于我们的医疗和医护工作人员，这个更加是冲到一线。
They are contributing to this battle in their own way. Even if they're unrelated to the medical material industry, many of them are donating money and other types of materials. These masks can prevent most citizens from the risks of catching the epidemic. So we sincerely wish that we will win this battle fast and clean, and we trust our medical workers to return safely to their families.